Hello, everyone. Welcome to the second installment of our Career Insight series for the spring semester, Careers in Clinical Psychology. My name is Jihyun Ju, and I'm an advisor and program coordinator here at Beyond Barnard. We'll be hearing from 3 Barnard alums today. Thank you so much to our panelists for making the time to join us. The bios of our alums I'm going to drop in the chat in just a hot second. There will be an audience Q&A toward the end of our program for our students in the room who are interested in asking our panelists a question. Feel free to unmute yourself whenever the time comes. Okay, so our first question is going to be introduction. For our panelists, what is your current role and what sparked your initial interest in the work that you're doing now? And anyone can feel free to jump in.
I guess I can kick things off. My name is Joanne. I got my PhD in clinical psychology at St. John's University. I took a gap year between Barnard and grad school to get some more experiences, to prepare my applications. And I'm currently a psychologist at Headspace, which is an app. It was originally an app focused on mostly mindfulness and meditation, but it has since expanded to offer other sorts of support for mental health and wellness. So I primarily do one-on-one therapy with adults through the app, and I was drawn to that specific company. I applied there actually for my postdoc, and I stayed on after that because I'm interested in the interaction between technology, wellness, and mental health. And I was excited about, being part of an industry where it was that combination was being explored.
I'm Sarah Anolik. I have a PsyD, so a doctorate in clinical psychology, and I have a private practice. And started my private practice about a year and a half ago after finishing my postdoc. I think I really enjoyed individual work and wanted to continue that. So it was a really natural kind of progression to get into private practice. I'm happy to talk more about, I guess, what sparked my interest in psychology more broadly, but I think that will come later.
It's small already. No just turn your camera
on. Okay, so I'll go next, I guess. My name is Anouk Allart. I received my PhD in clinical psychology from Fairleigh Dickinson University. I had also taken some time. I took 2 years between Barnard and grad school just to get more experience. And currently one of my roles is to be a supervising psychologist at a private practice. That's a private group practice called the Center for Anxiety. And obviously there we focus a lot on working with clients who present with different anxiety disorders as well as mood disorders. I also started there as my postdoc, and I think what really sparked kind of my interest for this specific role, I can also speak more broadly into about psychology, but for staying in this specific center would be the fact that I have the opportunity to work with adults and also adolescents and children, which is not always the case in different settings. And that's something that was really important to me because I believe in really working with people across the lifespan, and that really matched my values. So that's a little bit about me.
Beautiful. Thank you all so much. As you guys are in this field under different capacities, I'm curious to know, and I'm sure our students are curious to know as well, what does your day-to-day work look like? And again, anyone can jump in to start the conversation.
So one of the really lovely things about having a private practice is that I get to decide my schedule entirely. I have young children, and so I don't do evening hours. I am very busy because I love my work and it's hard to say no to new patients. But mostly I'm meeting with people one-on-one. At this point, it's probably about a third in person, and the rest I'm meeting by telehealth. And other than that, I have a weekly case consultation group set up with some colleagues from different parts of my, guess, professional journey. And I'm involved in a psychoanalytic institute in Philadelphia. And so I also one day a week am taking classes and I have a role on the executive board. So I participate in those kinds of meetings. And as part of my psychoanalytic training, I'm in my own psychoanalysis 4 days a week. So that occupies quite a bit of time as well. And have an hourly, once week meeting with a supervisor. And supervision in clinical psychology means usually choosing one or a few patients to focus on and talking to that person about your clinical work and any kinds of issues that are coming up.
Yeah, I would say I also have some flexibility in terms of my day-to-day schedule. I'm more the opposite of most of my hours are in the evening, just in terms of like the population I work with. Also, most kids would be after school or people after work that I see. Also hard to say no to working with new people. So I tend to have pretty high clinical hours, just one-on-one individual sessions. I also run one of the groups that we have at our center, which is a dialectical behavior therapy group, which is really fun. I like having a group because it is very different than individual therapy. So I kind of like having that diversity. And as one of the supervisors in the clinic, I also have weekly, I provide supervision individually to some of the trainees, so who are more junior faculties, either still who are students who are completing their internship, which is a process in the clinical psychology doctorate program, or who are postdoctoral students starting off at the clinic. And I also run a group supervision for all the trainees as well, which is also once a week. So I like kind of having these different little hats that I can put on. It kind of breaks up my day in a nice way.
Yeah, my situation is pretty similar to both of you, and thank you both for sharing. So at Headspace, I'm primarily doing, like I said, one-on-one therapy, and so I have a lot of flexibility with my hours. We are all telehealth at this time, so I see people completely virtually, and I have full control over when I want to have my hours, as long as we have a certain number of patient hours or client hours scheduled per week. That's kind of what is expected of us. And so for me, I have all of my sessions in the afternoons and evenings, and I have the mornings for myself. I actually am still training as a ballet dancer recreationally, and I have a small art business on the side. And so my mornings are spent on those things. And in the afternoons and the evenings are all dedicated to client work, and that's just by choice. And in addition to one-on-one sessions, we have to attend a couple of company-wide meetings per week. I also meet for a group consultation where we discuss cases that are maybe more complex or difficult. And Headspace does provide us with weekly trainings and lectures, which is nice because we get to kind of feel like I feel like I get to continue to grow and learn. And yeah, it's always something interesting.
Wonderful. Just building off of that, I think thinking on your career trajectory thus far, what opportunities did you find to be most nourishing for you in getting involved in this current field? And this could be, during your undergraduate career at Barnard. It could be recently. Any of those experiences work.
I mean, I think, oops, sorry.
You go first.
I think for me personally, throughout from, Barnard ever since has been very nourishing. I didn't start off college knowing necessarily what I wanted to do. But pretty much since my intro to psych class was my first experience, I had a really wonderful professor who sparked kind of that interest in me. And so then also inspired me in terms of the classes I wanted to take. So even just the classes at Barnard that were offered really kind of helped me understand which areas of psychology were more interesting for me. I think taking the time between college and grad school was also really important for me, especially because with a program like a doctorate program, which is a significant amount of time, I wanted to make sure that I made that decision, like with having experience, and it was a well thought out decision. And I worked in a research lab, so I had a lot of research exposure during that time, and it was with a clinical population, which is also how it connected still the clinical pursuit. But I would say that the most nourishing really has been all the experiences that I've been able to have throughout my graduate training, in a sense that one thing I love about clinical psychology training is that you are placed in different settings to get practice, right? So it's not just learning in theory, there's actual, you're in centers and you learn there. And I really made sure that I explored as many different type of settings, working with different populations, as much as I could to really get a full idea. Because again, I think that that's what's the most nourishing about this process, is really being able to explore all of the potential field or potential focuses that you can have in clinical psychology before really fully defining what your long-term goal is. And so I would say like each step along the way brought me closer to where I am now. And I feel like if it wasn't for that, I would maybe have questioned some of my choices along the way, which I didn't. So yeah, that would be that.
I also came to Barnard not knowing exactly what I wanted to study or major in. I dabbled around a little bit, and actually it was, I think, the winter break before my sophomore spring. And at least when I was there, I don't know if it's still the case, we're expected to kind of declare a major sometime after that. And I was very stressed, and I got advice to just go through the entire course catalog at the university and write down all of the courses I was interested in just based on their descriptions. And they happened to all be these psychology courses. So I took a leap and signed up for a whole bunch, and I ended up sticking with all of them. I was very lucky. I got into a seminar as a sophomore called Emotions and Self-Regulation, and that I really credit as inspiring me to pursue clinical psychology, because I got to see what what skills we can teach, and the introspection that we can gain by like looking into what drives our behaviors and our emotions, and how we can make changes to those things, and then actually have really positive effects on our lives. So I think the firsthand experience with some therapy skills or just kind of a space of introspection was really powerful for me, and also helped to keep me going during, I think, like Anouk said, the very, very long slog of graduate school. It was just inspiring to think that maybe I can also help pass these skills and this kind of open space to others in the future.
I really appreciated the language of nourishing. I thought it was an interesting question. And I think in particular, because there's so much that, like working as a clinical psychologist, there's so much that we hold for patients and also so much of ourselves that we give. And so it is so important to be able to have opportunities that are sustaining, that are nourishing. And so I don't know if there's another question that sort of like talks about trajectory, but I had a much more wayward kind of path to getting to where it is that I am now. I had worked in a neuroscience research lab while I was at Barnard, which I thought was like fascinating and really intellectually rigorous. but it was sort of missing the human connection. And I don't think I quite realized that that was why it wasn't as interesting to me. I ended up working in the fashion industry for 3 or 4 years, and then did a master's in social and organizational psychology. And that was where I started to take some clinical psychology classes, ended up being able to get this job at Columbia Medical Center, doing intakes for all of their outpatient psychiatry programs, and had like just a really wonderful, had a few really wonderful mentors who were really encouraging. And I think, I don't know, I like laugh now because I think it's like, so, I don't know, like I sort of knew at the age of like 22 that I wanted to pursue clinical psychology, but had friends who had worked in lots of research labs and knew that this was what they wanted to do and had already, gotten into doctoral programs. And so I thought it was like too late. It wasn't too late. I don't think it's, I actually have a colleague who's like in their 50s and now planning to go through psychoanalytic training. So I don't think it's ever too late. But ultimately the relationships that I had with, certainly thinking about the people who are in my cohort in grad school, you're like a lot of, some cohorts are like, my cohort was 6 people. So these are people you spend so much time with. And also identifying certain mentors, certain professors who, you feel that you can really open up to. And I think being in therapy, I mean, I think that's like been an enormous driver of my own interest. There's sort of the expression of like research is me search. That I think a lot of people are driven to the field of psychology because they're curious about, something in their own lives. And so I think being able to have that experience of being in therapy is really important, and often like really largely shapes how people practice. So, I think that too can be really important.
Beautiful. Something, a common sort of theme that I'm hearing from all 3 of you is that all of you didn't know whether you wanted to go into this pathway when you were at Barnard. And, it just seems like the possibilities are really vast in this field. And a couple of you have spoken about the process of sort of finding your specific focus. And that leads me to my next question. As this is one of those fields that require additional education post-Barnard, can you speak on your process of selecting graduate programs? What did you look for when you were selecting the right school for you, the right programs for you?
So if you know that you're interested in a doctorate program and haven't already gotten, there's like this big guide to all clinical and counseling doctoral programs in the United States that is really, really helpful. I get that book. And I knew that I was interested in psychodynamic or psychoanalytically oriented programs. And so that was something that was specified in this comprehensive book of all of these programs. I was also looking at geographic regions. I knew I wanted to be on kind of the East or West Coast. And there's a consideration of a few different kinds of degrees. So there's, a PhD in counseling or clinical psychology. I went the route of doing a PsyD, which historically is more clinically oriented, although I think at this point there's depending on the university, there's a lot of overlap. I think that the finances are an important piece. And so like ultimately, because of where I was at my point, the point I was at in life, I was getting married and knew that I wanted to start a family, and I really just was not willing to take on debt. And so I had to like turn down some offers from programs that I really loved because it was too appealing to have to have my schooling paid for and a stipend, instead of having to like end up with debt, which is hard. Because I think also as a psychologist, it's different from medical school. It's not like you're necessarily graduating and making like $200,000 a year and able to pay that off. So I think that's an important consideration. I applied 2 years in a row. And so I'd gotten a few interviews my first time around. And I think I was just not like, I think I was applying to the wrong programs and was sort of like presenting something that wasn't fully authentic. And so the second year I was much more strategic. I applied to a lot more programs, got a ton of interviews, and and then had lots of conversations with people in order to figure out what the best avenue was. But I really recommend this book. I can try to find it and maybe put it in the chat if that would be helpful.
I echo a lot of what Sarah just said. Those were some factors that were priority for me. Number one was location. I come from a very, very close family, and I didn't want to be anywhere outside of the tri-state area. So that narrowed down my search a lot. And I'm someone who was mostly interested in cognitive behavioral therapy, but was open to programs that were more eclectic. So that was another thing that I wanted to consider. In terms of PhD versus PsyD, again, I agree that I think that the distinction has become a little less clear. But at that time, I was told that, I wasn't really sure whether I wanted to do more clinical work, more program development work, more research. And so I was, recommended to pursue PhD in order to kind of explore those options. But again, I think that has become less and less with time. Another thing that was really, really helpful was speaking to students who were currently at the schools I was applying to. I was pretty shameless in asking if I could be connected, and really asking those students about their day-to-day, asking about what it was like to work with particular mentors, personality styles. And another thing also, if you're interested in the research route, and many PhD programs require you to apply to specific mentors or professors at the program. So really getting a sense of, what that person is studying, what kind of work they're doing, because you're likely going to be contributing to their work in some way. And so all of those things are, those are all considerations that helped me to narrow down my search.
Yeah, I think a lot of the same factors were in play for me. Location, for sure. For me in a different way, in that I was an international student, and having gone to Barnard, I feel like I had established myself in New York and wanted to stay in a tri-state area or in that proximity. So that played a big role in my applying to schools. And then for sure cost also, because for sure in the tri-state area, there's a lot of variety. Some programs do offer, full tuition and have a stipend. Some really don't. Some offer some benefits, but not all. So looking at all the different offers was really important. I think Joanne also already said this, but some programs lean more in terms of training in one orientation or another. I personally chose a program that really trained you in all different, in psychodynamic, cognitive, and newer waves, forms of therapy. I think an important factor also, and I don't know if it's still the case now, I feel like I'm aging myself here, but in terms of certain programs require you to apply to a specific faculty member. And so making sure you look at the research, like if you're looking at a specific program, what research is being done, because if you're going to be working with that mentor, the likelihood of you kind of doing your dissertation on a similar topic or something based on the research that's already being done at the university will be important. Of course, everything else that was said also. And I think if you're looking at different programs, there are kind of program outcomes that you can check. And I think that's also important to look at in terms of number one, attrition in the program, as well as time to graduate, because some programs can be shorter or longer. And depending on your ability to commit to longer or, to commit to either longer or shorter type of program. I think the shortest is still around 5 years, and it can go as much as 7+ years for some programs. And finally, something that tends to be really important and will become important once you are in a clinical psychology program is internship placement. And so programs that have a high placement rate often, kind of would place higher on my personal list when I applied.
Wonderful. I feel like all of you guys have already started giving such fruitful advice to our students in the room. But my next question for you all is, what advice would you give to students who are interested in pursuing a career in clinical psychology, but are unsure of where to start?
I feel like Joanne was talking about this, but I mean, having it's so helpful to have conversations with people. And to Anouk's point about looking at sort of the outcomes and where people end up on internship and in their careers afterwards. I mean, I just think reaching out and talking to whoever is willing to speak with you is enormously helpful. And I think being organized, having the Excel spreadsheet and listing out the locations and whatever the most important parameters are for you, and just kind of staying on top of that. But I mean, I think that I think that part of what I think is so wonderful about this field is that there's just eternal growth, and there's so much opportunity and so many different things that you can do. And so I think kind of keeping in mind that openness, you don't have to know, and you're not going to know, you can't know what it is that things are going to look like in the future. And so yeah, maybe starting to get a bit comfortable with the ambiguity of what it's like to work in this field, including in the process of starting to apply. That's a good place to start.
Yeah, just I think going back to that point that Sarah also echoed, I was so grateful for all the people that spoke with me when I reached out, and I've been trying to, reciprocate and give back by attending panels like these, just because I know how valuable it was to learn what the day-to-day looks like for any career that you choose to go into, because something can sound great on paper, but then you don't really know until you see what an actual week in the life would look like.
I'm stalking you now.
And so I highly encourage that. And that also applies to reaching out to people who are currently in grad school, asking what grad school is like, but also knowing that there is life after grad school, and making sure that the lifestyle that comes after grad school with the different kinds of opportunities also appeals to you. So that would be the advice I have. And also just leaning into, again, going back to what Sarah's point was, that there's so much ambiguity. So whatever career you go into, just making sure that you take care of yourself and reminding yourself that you are your career and so many other things. So that's just something I want to drive home as well.
Yeah, I think actually the point about ambiguity is a great one that could have been also brought earlier in some of the questions that we had, in the sense of I think something that really drove me into this field actually is the fact that there's so many opportunities, right? I mean, I know that currently most of us do one-on-one therapy sessions, but there's also so much beyond that, like teaching and other opportunities that come with this profession. So again, if it feels overwhelming right now, it's okay. It's you don't have to have it all figured out right this minute. And it's just kind of, the idea is it'll probably work out just fine. It is a tough sometimes road. And again, I know that Sarah had also said this, but the people that you'll meet in your graduate programs, you'll work closely with, right? So you'll have all these often great experience. So I think, starting by factors that you feel will be important in terms of maintaining self-care, whether that means, finding starting off by thinking like, hey, could I really go study anywhere? Or are there actually concerns about that? Hey, do I really want to be in debt when I graduate versus not? So asking yourself these kind of questions, because it is a long road, and kind of making sure that you have kind of almost all your support as much as you can have, that can really ensure your resilience throughout a program. I think those are important factors to take into consideration. Of course, in addition to everything that's been said, and thank you, Sarah, for the book, because I didn't know that existed, and I will definitely keep that one in mind. So I think that's a great place to start too.
Yeah, I love the spotlight on networking here. It's, it's certainly a component of career building that we talk about frequently here at Beyond Barnard as well. Sarah and Anouk, you touched on it as well. This idea of eternal growth in this field, I think, is actually really beautiful. For our students in the room, we're reaching our final question to our panelists. So please prepare your questions. The floor will be yours in just a moment. To our panelists, what are your hopes for your career and your profession in general? This is a little bit of a heavier question.
In terms of actual trajectory, I just finished my postdoc, and this is, my first year after finally now being licensed and everything. So I'm pretty new in terms of professionally speaking. And things may change. And I think that is the advantage of being in a field that is so dynamic, is that I can wear a hat right now, and then in a couple of years, if I decide I want to do something else, I can. But in terms of my vision, I long-term see myself continuing to work one-on-one with a certain number of clients. I really like to be, hands-on in the field, like doing the work with people. But I also see myself trying to do something that's also, it harnesses my creativity. I mentioned that I also do art, so I'm hoping to maybe combine my love for art and psychology in a way, which is still in the works, but I'm hoping to take steps on that in the upcoming year. So we'll see. And I think that just my ultimate hope for my career is that I can, this is, I think, the reason why all of us have gone into this field, is to actually make a difference for people and to help others achieve insight and healing and growth. And if I can do that, that's all I can ask for.
Yeah, I would say similarly, continuing along the lines of what I've been doing so far. I'm very happy in my current practice. And I think something that I would like to start to include, I'm actually looking into now, is to start teaching again. I may have the opportunity to do that at the school where I graduated from. Because it's, again, a completely different side of psychology that also keeps me engaged and learning. Aside from learning from my patients, which I do every day, it's a different type of learning. I think that would be great. And I do have this aspiration of eventually going back, maybe not necessarily to France, but somewhere in Europe. Because I find it's very interesting there how psychology is practiced, which is very different. And there's a lot of focus on psychological research, but there is less advancements in practice. And not that I'm saying I want to revolutionize psychology practice in Europe. I feel like it would be interesting to kind of bring on some of, the learning that I have here, and then take on some of the teaching that is from there too. So again, continuing to grow, always the main inspiration here.
And I kind of don't know. So I'm not really, I feel like at this point, as I mentioned, I have like 2 toddlers and life is just so busy. And I have started psychoanalytic training. So I'm like in this process. That's also a very long process of becoming a psychoanalyst. So I feel like in some ways I have enough on my plate and I'm like settled in. Like I'm obsessed with my work. Like I just like, I find it so meaningful and interesting and important, and I love my patients. Like I just feel so fortunate for being in the spot that I'm in. And I think that what I can imagine is possibly continuing to have different roles at kind of in these communities that I'm in. So, you know, the Psychoanalytic Institute that I'm in, continuing to have maybe teaching or leadership positions in that, you know, as I kind of progress through my own training. And also whatever kind of to this idea of networking, like we have the networks that are in front of us, but there's all of these people who you kind of interact with along the way, and so there's always ways of kind of getting involved in in places that you've been before. I think I'm also really interested in writing and scholarship, and have been doing a lot of writing, and a lot of psychodynamic papers are sort of about like clinical cases and countertransference. So, how it is that therapists feel in the interaction, and sort of what it means for there to be this relationship between two people. And I think there's been this this history in psychoanalysis, at least, of people kind of like talking about their own life experiences or their own analyses, but like disguising it as though it was one of their patients. And I think that there's kind of increasingly a move towards more like almost memoir kinds of scholarship, where people can more openly talk about their own experiences as clinicians or even patients. And I think that's something that I find really interesting, really exciting. And so I can imagine possibly doing something with that too.
Beautiful. Thank you all so much. I feel like I'm learning so much from this panel as well. I'm opening up the floor to our students. You can feel free to unmute yourselves. You can direct a question to a specific panelist or to the collective group. If you're feeling shy, you can also start writing your questions out in the chat as well.
Hey, can I ask a question?
Of course, go for it.
Sorry, I'm in the library, so when I went out to a place where I could talk, but thank you all for a really great panel. And I was wondering, like, in terms of burnout or like managing sort of all of this, like something I worry about, like sort of being able to take care of yourself and also feeling responsible for patients. And I was wondering if you, like, how you guys are able to balance that. Thank you.
Mm-hmm. I mean, I think that looks really different for everyone. I think I had expected that private practice would be like really isolating, really draining, and I like really didn't understand how people could even go into private practice. And I've just found it to be like almost the opposite. Like I feel very energized by my work. And I had supervisors along the way who made it really clear, like, you give so much of yourself, you have to like, you need to take a break, that like this, like ultimately these are real relationships that I have with my patients, and I wouldn't be able to continue to give in the way that I do if I didn't take time off. So I'm like very clear about setting aside like whole weeks. So I think the past 2 years I've taken like 4 weeks off at different points. So I think taking time off is important. And like having just relationships, like I think relationships are sustaining, and having, I have colleagues at this point from internship and from postdoc and from graduate school. And so, I mean, even like last night, I had a case presentation and I was feeling really lousy about it because I didn't love the feedback I was getting. And called up a friend and she, from internship, and she read my process notes and we were talking through, and it was just like, it was such a, I don't know, it was such a reminder of the importance of having friends. who can, I guess I'm liking this word, who can nourish you, who can kind of help to fill up your bucket also.
And Bella, I feel that question so profoundly. I am a textbook introvert. And so I was very concerned also about the idea of how will I make sure that I don't get burned out when I will be spending many hours holding space for people and really being present and interacting. And so that is why I, again, ultimately see myself as doing part-time clinical work with the direct one-on-one interactions, but then also carving out another area where I can, engage in clinical psychology in a different form. So like I said, I'm considering, it's kind of a work in progress right now, but I know Anouk has spoken to the idea of teaching, the idea of supervision has come up before, writing, there are so many different ways to engage. And that's the beauty of this fields that you can kind of create a space for yourself. But during the times when I've had to do, full-time clinical work, that was when I really doubled down and, stayed true to my self-care practices, the dance, the art, making time for loved ones. That is all super important. And also it is it can be depleting in some ways, but also energizing. Well, when you see the work that clients are making and the progress that they're making, so it's almost paradoxical. But yeah, just leaning into self-care and also reminding yourself that you can change your path or design it in a way that works for you.
Yeah, just to echo some of what's been said here, I mean, a big part of my dissertation had related to the importance of social support and mental health. So I can't emphasize enough the importance of having people in your corner. And also, I think having a certain level of self-introspection can really help with burnout. Kind of, some days I feel very energized, some days I feel more tired at the end of the day, and kind of understanding, why am I feeling tired? Kind of putting it back on myself and learning what you need for yourself in that moment. If it is taking a break, if it is taking a vacation, if it is engaging in a hobby that you have, kind of really always checking in with yourself and setting certain boundaries that you can commit to throughout, I think is important in finding that balance too.
Great question. We have a question in the chat. It looks like it's a two-part question from Annika. Anouk, you mentioned that you're interested in this field because there are so many opportunities, such as teaching. Can you expand upon what other opportunities may look like? Also, Joanne, can you expand upon how clinical psychology is a dynamic field? And of course, Sarah, if you want to add to your, these questions as well, please feel free.
Yeah, so to answer that first part here, I think, beyond teaching or being part of a faculty team of a university, I think Sarah touched upon that a bit by saying that she was engaged in writing herself and, being the ability to write and publish is a great opportunity. There's also opportunity to be part of a clinical team in a research kind of environment. So, being your clinical practice, being more in the service of research as opposed to more individual clients, I think are some of the main roads that people take. But others, please, Joanne, Sarah, feel free to add if you can think of other main or other less.
Well, I'm just thinking, not like none of us are. Well, it seems like none of us are in academic positions, so there's certainly the more like research oriented, working at a hospital as a researcher, like a, primary investigator, or continuing on, even like down some kind of a tenure track of becoming an academic. So that's, I think that's also like a big option. Although I think there was a study about how like most people who apply to graduate school say that they want to be like academic researchers, and then most people end up in private practice. So there is sort of like and part of it is just the scarcity of like positions in academia. But yeah, there's a bit of a mismatch in some of that.
Yeah, and to address the second part of the question, but I think it really ties into what Anouk and Sarah spoke to. When I was saying dynamic, I was really referring to all of these different opportunities that you can take your clinical knowledge and expertise in. Another area, which is something I'm interested in, is industry, right? Technology, and I think also going another reason, another I guess definition for dynamic, right, is the field is changing right now. I think in the past 4 years with COVID and the opening up of telehealth and I think also breaking down of a lot of stigma, people talking about mental health more, posting about it on social media, right? And I think this field is changing really quickly, which is on the one hand, disruptive and nerve-wracking, but also extremely exciting because it means so many more opportunities are coming up. There's now people are experimenting with AI therapy and all of that. And there's just, I guess, no end to what we can apply our skills to. So when there's people involved, psychology is involved, and clinical psychology is a very fruitful area. So yeah, dynamic in terms of it's actually changing. And dynamic in that there are many opportunities to take your skills into.
We have room for, I think, 2 more questions for students in the room. Yes, Chantal, go for it.
Hi, sorry, I was just doing the hand raising thing in case somebody in the chat put something. But I guess my question is, I know even though most of you guys talked about how you weren't really sure in your Barnard undergrad time about what you wanted to do with clinical psychology, but I think if you were to look back and like give advice to either your past self or like current students about what you would, I guess, suggest or recommend them do inside or outside of Barnard, like steps to take to kind of understand the track better or like understand what you're getting into better, like besides what we talked about with networking, like do you suggest like research or internships or shadowing, or like, I guess, yeah, like if you were to do it again, what would you do?
That's such a good question. I mean, in some ways, I feel like so removed from kind of who I was when I was at Barnard. And I think that even though I think I had a kind of, I said before, wayward path to clinical psychology, I actually feel like a lot of, so I mean, I worked in like the corporate sector for about 5 years before going to grad school. And I find that a lot of some of the patients who come to me know that about me and appreciate that I understand something about corporate culture. I mean, I think having like lived experiences helps so much as a clinician. And so in a way, like I don't think that like you can it's like I don't think you can go wrong. I think it's important to kind of think about, I don't know, like following the things that are interesting to you. And so I do think that a lot of programs will want to see that you have some research experience, particularly if you're going to be in this process of, conducting research and writing a dissertation. So I think that's, something that's important. Yeah, I don't know. I think I would just tell myself to like hang in there. Like it's gonna happen. What happens will happen. Hang in there.
Yeah, I think Sarah's spot on. I also would have told myself to read through the course catalog sooner. I think I would have arrived at psychology a lot sooner. So I think that's also just speaks to, it doesn't have to be networking directly one-on-one with someone, but seeing if you can find out what it's like to live the life of whatever it is that you're possibly interested in. I also remember watching a lot of YouTube videos of like life in a day of a psychologist and things like that. And that was very valuable. And kind of also speaking to what Sarah said, that you're going to be okay. There is a term in industry that we call like building the plane as we're flying it. So that it's just this reminder that whatever path you're taking, you can always, you can't control what you've done in the past, for example, but you can always control your next step, and reminding yourself that life is all about pivoting and editing as you learn more and get more data points about yourself and your interests. So, trying to get as much experiences as you can so that you can get more data, and then reminding yourself that you are more resilient and flexible than we sometimes give ourselves credit for.
Yeah, I think reflecting on some of the things that have been helpful outside of what we've discussed is also just talking to professors at the school, right? And kind of hearing their path and what led to their decisions. Like my mentor was really helpful in that, my advisor was really helpful in thinking that through, and also thinking about what opportunities you can already have while still at Barnard. I know I had a summer internship volunteering at an inpatient hospital, which was really cool to have while I was still undergrad. And also, as a senior, I did a senior thesis, which meant like already being involved in a research lab. So also kind of already putting, dipping your foot in the field in any way that you can. There are definitely opportunities you can already have, even while undergrad still.
And I
Thank
also
you so
I think
much.
there's
Oh,
a
sorry,
certain
continue.
kind of there, when you are in an academic institution, I think there is a certain kind of recognition, like when you reach out to people, you almost have more license to be asking questions as a student. So when you're just out there in the field, people might be potentially less receptive. But being a student and just trying to get information, I think a lot of times people are really, really receptive to that.
Thank you so much. That makes sense.
We have time for one final question. Anyone else? We don't have any other student questions, then we will close out our event here. I just want to take a moment to thank our panelists again for joining us today and providing such thoughtful insight. For our panelists, you'll be hearing from me. I'll put everyone in an email so you guys can exchange contact information as well. For our students in the room, we hope to see you at our next Career Insights event. Everyone have a great rest of your day. Thank you all so much. Bye.
Bye.